immunologic history or memory from past exposures. So we are a little bit more vulnerable because our body hasn't been dealing with flu viruses for the last couple of years.
Between 2015 and 2019, BC saw just 2 or 3 flu-related deaths per year, and that was in people 18 years of age or younger. Here we are, 6 child and youth deaths in BC alone so far this year. What does this tell us about what is yet to come?
Well, that's a really good question. We know normally that flu season sort of peaks towards the end of December, beginning of January. It looks from the latest data that's perhaps peaking a little bit earlier this year, and I hope we have reached the peak, but it definitely could get worse. As for the children involved, 6 is a very low number, but of course a complete tragedy to the families, people involved. But the issue is that the current flu strain doesn't have some sort of predilection for affecting children more seriously. And we don't really know the answer to that question yet. I think it's probably just the numbers. We have a lot of people infected, so there are going to be people getting more sick because there's just so many people sick in the first place. But there could be something about this H3 type flu that does specifically target children. We don't have a comfortable answer to that question just yet.
And Dr. Henry said yesterday that the BC Centre for Disease Control will start posting weekly surveillance reports on the flu, including any more child and youth deaths. What do you make of that response?
Well, I think it's an appropriate response, and we should be keeping an eye out on it. But
yes.
I think it will be, unfortunately, a little bit time till we get more experience as to whether we can judge that this is a sufficient response or whether other measures, returning to masking, something like that may be necessary if the virulence of this flu does seem to be increasing.
If people went back to wearing masks, would we see the spread of this flu slow down, do you think?
I think it probably would reduce to a significant degree. The older literature pre-pandemic
the mask.
That masking in flu season
mask. I want a mask.
Effective as we would like in terms of trying to prevent flu transmission. But our experience during the pandemic has really showed that masking, social distancing definitely had a dramatic impact on almost eliminating the flu in British Columbia up until this year.
And so why are we not seeing public health officials take a stronger stance when it comes to masking, not necessarily imposing a mandate, but being very clear that masking has real benefits?
That's a complex question, but I think it's balancing out the other concerns, both of liberty and personal choice, versus the public health mandate. And so definitely I think masking would
This
reduce
building is full of masked people. This one,
however, the question is whether
one,
in a mask mandate,
everyone.
It's a big tool to use, and whether it's worth our current burden of flu, I think that's the policy question that our public health officials are grappling with.
See, again, when I ask about recommending mask use, everybody says, no, a mandate's going to be hard. I'm not talking about a mandate. I'm talking about being more direct and more clear about the benefits of wearing a mask if you choose to do so.
Subtle enforcement.
I think part of the conflict is driven by the evidence pre-pandemic, that it was very mixed. I was asked about masking many times early on in the pandemic, and I told people the evidence was not that clear that it was helpful or effective.
Yeah.
But balanced against that was our actual lived experience during the pandemic, that where we did have social distancing, we did have masking, people, the rate of flu was very, very, very low. And so I think there is a bit of a discrepancy from the published pre-2020 data showing masking doesn't help that much with the flu. You're touching your face more, you're around with your mask. There was a thought that it does not actually work in that data. But the experience during the pandemic is a very strong counter-argument to that.
Dr. Curry, really appreciate your time this morning. Thank you very much.
Thank you very much, Stephen.
Take care. Dr. Michael Curry, emergency room physician, clinical associate professor at the UBC Department of Emergency Medicine. 20 minutes after 8 o'clock.
CBC radio. The government funded radio station here in Canada. They always bring big names like calling the shots here, and they try to influence the people's minds. So I live in the area here full of Asians from China, And if I walk in the evening when they are most active, lots of people wear the masks. But guess what? They get sick. They get sick, and I don't. And why I don't get sick? I don't know. I don't have the answer. I don't have the data. I don't have the science. But I do. So they were talking about these new cases of flu-related death in the children, and they don't know why. They don't know why. Why? Because they shut down the real scientists during the pandemic. When the real scientists tried to have a voice, they were shut down, right? People got to jail for saying that. People lost their license for saying the truth. If you retrain the immune system using this mRNA vaccine, if you retrain this immune system, even not using the mRNA, but just dumping vaccines into a healthy, perfectly healthy child, what happens? I'll give you the non-scientific explanation, and maybe I did record that, but now it seems that people still need to wake up. So they are kept in the dark by the so-called scientists, promoted with free advertising by the CBC radio, because the CBC gets the money. It costs money to broadcast any type of news, right? It's a national radio station, and has not only tens of thousands of employees, but they have to pay licensing, they have to pay broadcasting fees, maintenance, and all that. It costs lots of money to maintain and own this type of equipment and broadcast. So guess what? The government is paying these fees, these amounts, so the CBC can get their agenda, promoting false news, promoting false information with the government money, using the taxpayers' money. That tells me it's an agenda. It's an agenda that use any means, any type of people, including these so-called doctors, professors. I don't give a shit about those, because if they know that they don't know, they should shut the fuck up. But they play the game. They are getting invited by this CBC radio host or whatever bullshit. They get invited and they take the opportunity. So if they knew that they don't know, if they knew that they don't know nothing, because right now during this interview the guy said nothing of essence, said nothing that he knows why those kids died, he knows why, if the mask works, if the mask does not work. He was just talking a couple of sentences and saying nothing. Like a more misleading or more playing the CBC radio host game, who was trying to make this guy say that, you know, we need the mask, because this fucking guy since 2020 kept pushing for masks and vaccines. This radio host fucking guy, and now he keeps trying and he keeps getting these people, so-called big names, on the show to play his agenda, because he gets paid to keep his job. He has to play the agenda. So he's a little robot with significance to many listeners, and he has to play that agenda, otherwise he would be replaced. That happens in the media. If you don't get the numbers, if you don't get the job done, if you don't play by the company contract, so in this case it's a contract with certain entities that is trying to push for a population control, like fear and all these things. I told you about that. Even it sounds a fucking conspiracy theory, but to me, to see this guy trying hard to bring back those mandates after people fought so hard. People went on the streets, people lost their jobs, people risked their lives to go places where they get exposed to violence and stuff like that. Myself, I've been marginalized even in my own family. I've been marginalized in my family for not following the agenda, not getting vaccinated, and I know that. But they are real heroes who got out on the streets and protested and took those risks. I could not take those risks, and I cannot tell you why. I do have certain type of work, and I cannot tell you why I don't go to protests and stuff. But I'm telling you, mandatory vaccination is stupid. And back to the real answer, the scientists, not me. I just copy what the real scientists said in 2020 and 2021. They said that if you vaccinate a person unnecessarily, it takes the immune system power to deal with the new viruses. So you retrain, and I said that in the past. That was my type of analogy. I like to use analogies to make it easier for people to understand. If you retrain your military, your soldiers, you train them to be specialized only in certain type of fighting, certain type of tasks. And if you equip those soldiers with special ammo and special guns just for a certain type of tasks, when they encounter something new, something different, they won't be prepared, because all their resources, like mental, physical, the body training, so programming the body to do certain things requires energy. And if that energy, that body energy, is being focused on fighting certain type of enemies, when the new enemies comes in, guess what? The whole military shut down, is dead, is gone. So imagine that you have these snipers and these Marines and these bullshit military soldiers who are super trained and super specialized in killing terrorists and all that. So you have those guys, right? And now you have a little ship of aliens coming in, dropping a couple of fuckers with weird weapons, right? Weird weapons that don't use the human known technology. It's like they shoot around the corners. They're light. Let's say they have some sort of a weapon, and they don't use the lasers. They don't use it. So they use a technology, some ionic shit that makes their thing to go around the corner. And they can see through their eyes, their mind eyes. They can see whatever they want to kill, or maybe they want to eat. So what these fucking Marines are going to do against those little fuckers, the aliens? They say, what the fuck? Oh, they killed my friend. They killed that guy. They killed him. Yeah, rescue. And rescue is not coming because they pee their pants. The command center is saying, fuck, I'm not sending more guys to the massacre. Okay. So that happens with the immune system. They have this aliens coming in. Even a flu virus is still an alien. We call it, but it could be like a human-shaped soldier, like I said about those aliens. It could be a human shape with legs and eyes and shit, but they are aliens. They are not from Earth, and they know different technology, different type of fighting. And what you do? Same thing with the immune system. Say this. What the fuck? Okay, they look like those guys I know, but they fight kind of weird, right? And okay, we have only these guns in here. Oh yeah, our technology is fucked. Can't really use it. So, talk to you later, beloved, because I love you. Bye bye.